What is HPV? Human papillomavirus, HPV, is a relatively common sexually transmitted disease passed on through genital contact, usually by sexual intercourse. What are the symptoms of HPV? There are more than 100 subtypes of HPV. Some forms of the virus can cause warts on the woman's cervix or vagina. Other forms of the virus can cause abnormal cell growth on the lining of the cervix, pre-malignant lesions that years later can turn into cancer. A Pap test can detect the infection. However, in more than 90% of cases, the infections are harmless and go away without treatment. The woman's own defense system eliminates the virus. Often, women experience no signs, symptoms, or health problems. Who is most susceptible to HPV? People who begin having sex at an early age, who have many sex partners, or who have sex with somebody who has had many partners, are at greatest risk of contracting HPV. In the United States, Black and Hispanic women have a higher incidence rate than white women. How prevalent and serious is cervical cancer? In the United States, about 7 women per every 100,000 contract cervical cancer. About 2.4 women per every 100,000 die. About 91% of all cases are in women 40 years of age and older. The median age of women when they are initially diagnosed with cervical cancer is 48. More than half of all cervical cancer deaths occur in women 55 years of age and older. Cervical cancer prevalence by age groups. Cervical cancer is more prevalent in older age groups. Only 1% of all cases are in females less than 30 years old. 73% of all cases are in women 50 years of age and older. Cervical cancer rates compared to other cancers. Cervical cancer is not as common as other types. For example, women are nearly 15 times more likely to be stricken with breast cancer than with cervical cancer. Rates for skin, colon, and lung cancer are also much higher. The HPV vaccine. In June of 2006, the FDA approved a new HPV vaccine, Gardasil, for 9 to 26-year-old girls and women. Gardasil is designed to protect against 4 of the more than 100 different HPV strains. A British manufacturer also developed an HPV vaccine. The HPV vaccine, 4 strains only. The HPV vaccine is designed to protect against just 4 of the more than 100 different strains capable of causing HPV infection. Strains 6 and 11 can cause genital warts. Strains 16 and 18 are associated with premalignant lesions. How is the HPV vaccine made? The HPV vaccine contains virus-like particles of HPV types 6, 11, 16, and 18, sodium chloride, sodium borate, L-histidine, and polysorbate 80, 225 micrograms of aluminum. How safe is the HPV vaccine? By August of 2008, just 26 months after the HPV vaccine was licensed, the FDA received more than 8,000 reports of injury and death after Gardasil. Young girls and women were stricken with serious and life-threatening disabilities, including Guillain-Barré syndrome, paralysis, loss of consciousness, seizures, convulsions, swollen body parts, and chest pain. Heart irregularities, kidney failure, visual disturbances, arthritis, difficulty breathing, severe rashes, persistent vomiting, miscarriages, and menstrual irregularities. Reproductive system complications, genital warts, vaginal lesions, and HPV infection, the main reason to vaccinate. Adverse reactions to the HPV vaccine. More than 8,000 American females have already been injured or died after receiving the HPV vaccine. How effective is the HPV vaccine? The HPV manufacturer boasts a 100% efficacy rate. However, this does not mean that women who take the vaccine are protected against cervical cancer. This only means that the vaccine is effective against the 2 premalignant strains in the vaccine. There are at least 15 premalignant strains of HPV. The vaccine is only designed to protect against 2 of these strains. During pre-licensure studies, 361 women who received Gardasil developed premalignant HPV lesions on their cervixes within 3 years. According to Scott Emerson, MD, PhD, and an FDA advisor on the HPV vaccine, I do believe that Gardasil protects against HPV 16 and 18, but the effect it will have on cervical cancer rates in this country is another question entirely. Premalignant HPV lesions. It is important to realize that no actual cases of cervical cancer were prevented in any of the test subjects in any of the clinical studies of the HPV vaccine. The HPV vaccine is only designed to protect against a limited number of premalignant HPV lesions that are often harmless and go away without treatment. The HPV vaccine has poor efficacy against high-grade lesions, the ones of greatest concern. Sexually active women. The HPV vaccine has poor efficacy in women who have already become sexually active. Teenage girls and young women who are sexually active may have already been exposed to HPV strains 16 and 18, the same ones included in the vaccine. The vaccine is not effective in women previously exposed to HPV strains 16 and 18. In fact, according to the FDA, the HPV vaccine actually increases a woman's chance of developing cervical cancer if she has already been infected by HPV strains included in the vaccine. The vaccine exacerbates a woman's pre-existing HPV infection. According to the Food and Drug Administration, we are concerned about the potential for Gardasil to enhance cervical disease in subjects who had evidence of persistent infection with vaccine-relevant HPV types prior to vaccination. Negative efficacy. In one study of women who tested positive for HPV strains 16 or 18 prior to receiving Gardasil, the vaccine had an efficacy rate of negative 45%. These women were significantly more likely than women who did not receive the vaccine to develop high-grade lesions associated with cervical cancer. According to George Sawaya, MD, an HPV vaccine study analyst, the recommendation for widespread vaccination of women after they become sexually active may need to be rethought. Vaccine alternatives. Numerous studies show convincing evidence that diet and nutritional factors can prevent many types of cancer, including cervical cancer, and even eliminate precursors to this disease. For example, in November 2003, Cancer Causes and Oncology published a study showing that folic acid is protective against premalignant lesions of the cervix. Another study published in the International Journal of Cancer found that tomatoes, high in lycopene, are protective against precancerous changes of the cervix. Summary of the HPV vaccine. HPV infections are usually harmless and resolve on their own. Cervical cancer is rare in younger females. Cervical cancer is not as common as other cancers. The FDA has already received more than 8,000 reports of injuries and death after HPV vaccination. The HPV vaccine is only effective against 4 strains. The HPV vaccine has poor efficacy against high-grade lesions, the ones of greatest concern. The HPV vaccine has poor efficacy in sexually active females and may increase the risk of cervical cancer. The HPV vaccine has never shown that it can prevent a single case of cervical cancer. There are nutritional alternatives to the HPV vaccine.